So our techniques use either ionizing radiation, like X-rays or radioactive tracers, or they use non-ionizing radiation, like magnetic fields or sound waves. Plenty of what we do comes from the same basic principles as you're learning in school, like radioactivity, or atomic structure, or half-lives, and on how these different types of radiation interact with the body. There is also an element of human biology in there because we need to know what the doctors are talking about. We need to know what areas we're either treating for disease or we're imaging to make sure that we get good quality images. I spend a lot of my time working in radiotherapy physics as my primary job. And radiotherapy is about treating cancer using high energy X-rays. We can also use electrons and other charged particles. These high energy X-rays are targeted at the site of disease using our linear accelerator, and those linear accelerators are very, very complicated, very well designed, and they're designed to target specifically the site of disease and spare the healthy tissue around it. I also spend some time in our planning department, which plans the radiotherapy treatments by using the patient's imaging data and the computer system to then send on treatments to be delivered to the patients. I also spend a bit of time working in the operating theatres where we insert radioactive tracers into patients' prostates to treat localized prostate cancer. I'm also a bit unique in my department as I get to work with our diagnostic radiology physics team as well. Diagnostic radiology is all about X-rays and CT scanning to take images. So taking images using these techniques, we have to make sure that the images that come out are of good quality while also reducing the radiation dose as much as possible. The same principles apply in radiotherapy. You need to treat what you are targeting, however, you need to also reduce the radiation dose as much as possible. So I spend a lot of my time working on machines that deliver ionizing radiation.